A very good morning to all of you. I am Anita Malik, Assistant Professor in Doon Valley Institute of Pharmacy and Medicine, Kannar. Today I am here to discuss about the topic first aid. What is in this session we all will came to know what is first aid, why do you need it, what are its benefits, and how by giving first aid you can prevent any further injuries, and it can also be a life saving. So you should all know about the various conditions of emergency and what first aid you have to give. So now we are starting with the basic definition of what is first aid. According to the Encyclopedia Britannica, it states that first aid is as the measures to be taken immediately after an accident, not with an idea to cure. What is this? These are the first aid are the measures to be taken immediately. Remember, first aid, that's why it is name is given first, and aid means help. So first means immediately after an accident. You don't have a time at that time to think how to cure, but just you have to focus on how to prevent a human being, a victim, further harm being done so that their conditions don't get miserable, and it uses the available human and material resources at the site of accident to provide initial care. How you can give first aid? By using the available human and material resources at your surroundings at that time at the site of the incident to provide initial care to the victim of injury or sudden illness until more advanced care is provided. You don't have to wait that you should carry a patient to the hospital, but at the site of that accident you have to give a first aid. So first it has the following main objectives. First one is to preserve the life. Second one is to prevent the victim's condition from getting worsening. It means you have to control the victim conditions. Third, to promote the recovery. Next is the goals of the first aid. What are the basic goals? Why you should give first aid? To rest, first one is to restore and maintain the vital functions. Vital means important functions like breathing, airway, circulation of a blood. So the basic goal depend upon the ABC of basic life support. What is ABC? And this A stands for airway, B stands for breathing, and C stands for circulation. These ABC means airway, breathing, and circulation are always be your first priority. It means you have to focus on these ABC. What is airway? It must be, it means the surrounding air. It must be open so that air containing oxygen enters the body of the victim. You don't have to rush all the people, don't need to overcrowd that area. Then next is B, breathing. Breathing must take place so that oxygen passes through the lungs into the bloodstream. Proper oxygen get into the lungs so that a person or a victim can breathe properly. And C means circulation. The heart must circulate the oxygen carrying the blood. Second goal is to prevent the further injury or deterioration. And third is to reassure the victim and make him or her as comfortable as possible. Means to reassure, you have to give assurance to the victim and make him or her as comfortable as possible. Next, coming to the first aid kit, what does it contain? Then coming to the now first aid kit. Following are the contents of the first aid kit. What your first aid kit should contain if you are going anywhere, if you are going to a traveling or anywhere, you must carry a first aid kit. It can be useful to you as well as to your co-passengers. So following are the contents of a first aid kit. First is cotton wool. Cotton, you should have a cotton in this or absorbent cotton. Adhesive tapes are there if you any wound. Then crepe bandages if any sprain is there. Then sterile dressings, bandages, thermometer for checking the temperature, scissors for surgical dressings, for gloves, soap, pain relievers, antacids, and ORS packets. ORS means oral rehydration syrups. This is helpful in the case of a diarrhea. ORS is oral rehydration syrup. If any person is suffering from dehydration or diarrhea, there is so much water loss. In that condition, at the first aid, you can give them a ORS so that it will helpful in making the person rehydrate. This is all about the first aid kit you should carry with your own. Next, what is the action plan? Action plan, just after seeing the victim, you have to immediate see these conditions. You have what you have to do, action, what you have to do. This action plan is a vital aid, means very important to the first aider. First aider means who is giving the first aid in assessing whether victim has any life threatening conditions, and if any immediate first aid is necessary. These are DRABC. What is DRABC? D is for danger. Danger, it can be to you, to others, or the two victims. Then R means checking response. Is victim conscious or is victim unconscious? Means victim can reply to your questions, or as victim goes unconsciousness or faint completely. Is then A is to check airway. Is airway clear of objects? There is no overcrowded near the victim. Is airway open? B is for breathing. Is chest like this rising and falling? Can you hear victim's breathing? Can you feel the breath on your cheeks? These all are the symptoms for breathing. Then C is to check for the circulation. Can you feel a pulse of the victim? Can you see any obvious signs of life? Means he is alive. These are the action plans all to check the person is alive or person is in what condition, life threatening conditions. Like you have to check the response of the person, airway, he can proper breathe or not. Checking for the circulation, there is feeling if you can feel a pulse or not. So these are the action plans, and these are the pictures which can describe the action plan. This is a DRAB. See also, step 1 is the danger. Are you on the casualty in the danger? If not and it is safe, approach the casualty. If you think that it should be safe to transfer the victim to the hospital, then you should approach the casualty. Second, response. Does the casualty means the victim respond to a command or gentle shake? That is, are they conscious or unconscious state? Then airway, if the casualty does not respond up, open their airway, put one hand on their forehead. Just put one hand on their forehead, two fingers on their jaw, and tilt their head back while lifting their chin. This is the airway. It means to open their mouth. Firstly, you have to put one hand on the forehead, two fingers on their jaw, and tilt their head back and lift their chin so that air can enter in their lungs. Then breathing. Firstly, you have to look, then listen and feel for breathing. If the casualty means patient is unconscious and breathing normally, put them into the recovery position. If the patient is breathing normally, put them into the recovery position and check for the injuries and dial 999 for an ambulance. So these all are the action plans. Now we are going to discuss one by one the emergent conditions and what you have to do and don'ts regarding them. First condition is fainting or losing consciousness. What is fainting? It is a brief loss of consciousness and it is a result of an interference with the function of the brain. What is consciousness or unconsciousness? This is due to the unconsciousness fainting. It is a brief loss of the consciousness and it is a result of an interference with the function of the brain. And there are many causes of unconsciousness. Consciousness can be done with the many causes, and the most common cause of unconsciousness are the fainting. When a person faint, there he can lose his consciousness. When there is any injury on a head, in epilepsy, in stroke, in heart attack, in any poisoning, in diabetes, like if the sugar level becomes very high and the conditions associated with the lack of oxygen, when a person is suffering from the condition when there is a lack of oxygen and oxygen can't reach to your brain properly in adequate amount, then a person can faint. And if you have seen a person fainting, if you see in front of you that any person is fainting, then what you have to do and what you have to do not. So here are some do's and don'ts. Do's: don't give the patient anything to eat or drink. Whenever a person is fainting in front of you, remember you don't have to give the patient anything to eat or drink. And now don't allow the person, second one is don't allow the person who has just fainted to get up, because he is not in the condition to get up. He may be into the danger condition, into worse condition also. Whenever you allow your any victim just to get up until the victim is in the fully conscious reason. Third one, if the area is warm, don't crowd around the victim. Remember, if the area is warm, if there is already a temperature rising, don't crowd over the victim.